Hey everyone, welcome back to the channel. I'm Dr. Ava Remington, and if you're new here, glad you found us. I've been practicing medicine for over 20 years now, and one thing I've learned is that the questions people are most embarrassed to ask are almost always the ones that matter the most. So today we're going there. We're talking about sexual abstinence, what actually happens to your body when you stop having sex, and whether that's something you should be concerned about or not. Now, before I get into it, I want to be upfront with you. I'm not here to scare you. I'm not here to make you feel like your body's falling apart. I've seen too many videos and too many articles online that just pile on the doom and gloom to get clicks, and frankly, that does more harm than good. My job, the same job I've had for 2 decades in the clinic, is to give you real information so you can make informed decisions about your own health. That's it. No fear tactics, just facts. Also, I want to acknowledge something right off the top. There are a lot of reasons why people choose to be sexually abstinent, or why abstinence just happens by circumstance. Religious or cultural beliefs, health conditions, the end of a long-term relationship, simply not meeting the right person. Stress, work, grief, life gets in the way. And for a lot of older men especially, these aren't abstract scenarios. They're Tuesday. So, everything I'm going to share today, I want you to hear it in that context. Not as judgment, but as information. All right, let's get into it. The term sexual abstinence gets used in a lot of different ways depending on who you ask. In the strictest sense, it means choosing to avoid all sexual contact. But abstinence isn't just for young people or people who've never been sexually active. Plenty of people who've had active sex lives for decades find themselves in periods of abstinence, sometimes by choice, sometimes not. And both of those situations are completely valid. People step back from sexual activity for all kinds of reasons: cultural or religious values, HIV prevention and reducing the risk of sexually transmitted infections, avoiding unwanted pregnancy. Medical reasons. For example, men are sometimes asked to abstain for 2 to 7 days before providing a sperm sample for in vitro fertilization to make sure sperm concentration is at its highest. Recovery from injury or illness. Or sometimes people just aren't ready, or they don't have the desire, and they don't feel the need to justify that to anyone. And that's completely fine. But here's what I want to spend most of our time on today. What's actually happening inside your body during extended periods of abstinence. Because whether you're going through this right now or you're just curious, understanding the physiology helps you take better care of yourself. Let's start with something that I talk about a lot with my male patients, particularly the guys who are getting up there in years. One of the more well-documented effects of long-term sexual abstinence in men is the potential increased risk of prostate issues, including prostate cancer. Now, I know that sounds alarming, but stick with me here because the mechanism actually makes a lot of sense. A 2016 study published in the European Urology Journal found that men who ejaculated an average of 21 times per month had a significantly reduced risk of prostate cancer compared to men who ejaculated less frequently. The thinking behind this is that ejaculation helps flush out the prostate. The seminal fluid, the fluid that carries sperm, is produced by the prostate gland, and when ejaculation happens less frequently, certain compounds can build up in the prostate tissue over time, and that buildup may contribute to prostate disease. Now, does this mean you need to panic if you've been abstinent for a few months? Absolutely not. But it does mean that for older men especially, prostate health is worth paying attention to. And this is one more reason to keep up with your regular prostate screenings. Don't skip those appointments, guys. I cannot stress that enough. Here's something that might surprise some of you, and it's a conversation I have pretty regularly in my practice with men in their 50s, 60s, and 70s. Sexual abstinence can contribute to erectile dysfunction. I know, nobody wants to hear that, but the evidence is there. A 2008 study published in the American Journal of Medicine found that men who were regularly sexually active had about a 50% lower risk of developing erectile dysfunction compared to men who weren't. Researchers are in general agreement that regular sexual activity has a positive reinforcing effect on erectile function. Your body, in a very real sense, responds to use. When the mechanisms that produce and maintain erections aren't being activated on a regular basis, they can start to become less reliable over time. Now, and this is important, regular sexual activity doesn't only mean partnered sex. I'll come back to this point in a few minutes because I know it's something a lot of you are thinking about and I don't want to gloss over it. Let's talk about some of the other effects that can happen with extended abstinence. Beyond the physical, there's also the question of libido, your sex drive. And this one is genuinely complicated because the research points in two different directions depending on the individual. For some people, abstinence leads to a decrease in libido over time. Here's why. During sexual activity, your body releases hormones, particularly endorphins, that create feelings of pleasure and well-being. When those hormones aren't being triggered regularly, your baseline desire for sex can actually decrease. Your body kind of recalibrates to a new normal. On the flip side, some studies suggest the opposite, that abstinence can actually increase libido because you're thinking about it more. The desire builds up, and the anticipation becomes part of the experience. So which is it? Honestly, it depends on the person. What researchers do generally agree on is that libido is largely shaped by experience and habit, and that regular sexual activity helps regulate and stabilize it over time. If abstinence is causing you distress because your desire has significantly dropped, that's worth mentioning to your doctor. Now here's one that doesn't get talked about nearly enough: the connection between sexual activity and immune function. Researchers at Wilkes University in Pennsylvania conducted a study with 100 college students and found that people who had sex twice a week had about 30% higher levels of immunoglobulin A, that's IgA, compared to those who were abstinent or rarely sexually active. IgA is literally your body's first line of defense against bacteria and viruses. It's the antibody that lines your mucous membranes, your nose, your throat, your gut. So when you're less sexually active, you may actually be giving up some immune protection, at least according to this research. Now, I'll be honest. This is one area where the science is still evolving, and one study isn't the whole picture. But it's an interesting data point, and it connects to a broader truth. The physical, hormonal, and immune systems in your body are deeply interconnected. Sexual activity is a form of physical activity, and physical activity in general supports immune health. Which brings me to the cardiovascular angle, and I want to handle this one very carefully because it's the area where I think a lot of health content online goes off the rails. Yes, sexual activity is a form of physical exercise. It temporarily elevates your heart rate and blood pressure. Your heart and blood vessels adapt to those changes during activity. And yes, there is evidence that men who are regularly sexually active tend to maintain better cardiovascular conditioning related to those kinds of exertions. Here's what I want to be very clear about though. If you have a heart condition or uncontrolled high blood pressure, the concern isn't abstinence itself. The concern is resuming intense physical or sexual activity without first stabilizing your cardiovascular health. If you've been abstinent for a long period of time and you have a heart condition, talk to your cardiologist before resuming sexual activity. Get your blood pressure stable. Make sure your heart is compensating well. This isn't unique to sex. It's the same advice we'd give before you start any new exercise program. The message here is not abstinence will kill you. The message is know your health status, communicate with your doctor, and don't go from 0 to 60 without a checkup first. If your blood pressure is well managed and your heart is in decent shape, there's no reason to be scared. Just be smart about it. Let's talk about stress for a second, because this is probably the most universally relatable piece of this conversation, regardless of age or circumstance. Sexual activity releases endorphins, the same chemicals that get released during exercise. These endorphins help your body and brain manage stress. When you're abstinent, you lose that particular stress relief valve. For some people, that's no big deal. They've got other outlets, good exercise habits, strong social connections. For others, especially men who are living alone, recently retired, dealing with loss, the cumulative stress can become more of an issue. I'm not saying abstinence causes mental health problems. I am saying that if you notice your stress levels are higher, your mood is lower, or you're feeling more isolated, those are worth addressing directly, whether through social connection, physical activity, therapy, or talking to your doctor. And on that note, self-confidence. Some men report that extended periods of abstinence affect their sense of themselves, their sense of attractiveness and desirability. That's real. Regular sexual intimacy, whether with a partner or in the form of self-care and self-connection, can contribute to feeling good about yourself. When that's absent for a long time, some men notice a dip in their overall confidence and mood. Again, not inevitable, not universal, but worth acknowledging honestly. Now, I promised I'd come back to something, and I want to make sure I do because I think it's one of the most important practical points in this whole conversation, and it's one that a lot of health channels just skip right over. What about masturbation and self-stimulation? Does that count? Can that address some of the health effects we've been talking about? The honest answer is yes, largely. For most of the physiological effects we've discussed, particularly for men, the health benefits associated with sexual activity are connected to the activity itself, including the hormonal responses, the physical exertion, and in the case of prostate health, ejaculation specifically. So, if you're not currently in a sexual relationship, self-stimulation is a completely valid, healthy, and normal way to maintain some of those physiological benefits. This isn't me being edgy or provocative. This is mainstream sexual health medicine. Your body doesn't really distinguish between the two in terms of most of the hormonal and prostate-related effects. Now, I want to address one more thing before I wrap up, because I think it goes to the heart of why a lot of people push back on content like this. There's an implicit assumption in a lot of videos about abstinence that goes something like, if you're not having sex, something is wrong and you need to fix it. And I think that's frankly irresponsible. Some people, plenty of people, choose abstinence intentionally and live full, healthy, happy lives. We have solid research showing that strong social bonds, purpose, physical activity, and mental engagement are the primary drivers of health and longevity. Sex can be a part of that picture, but it is not the whole picture. Not even close. I've had patients who were widowed in their 60s and chose not to pursue new sexual relationships because it didn't feel right for them. I've had patients who stepped back from sex for years while dealing with major life transitions. Most of them were just fine. The research we've talked about today describes tendencies and risks at a population level, not inevitabilities at the individual level. Your mileage will vary. Your body, your values, your circumstances matter. What I'd encourage you to do is this. Stay informed, stay connected with your healthcare provider, and don't let fear, whether it comes from a video online or anywhere else, drive your decisions. If you're curious about your prostate health, get checked. If you've noticed changes in erectile function, talk to your urologist. If your stress is high and your mood is low, address that directly. These are all manageable, treatable things when you catch them early and talk about them openly. One last thing I want to say, and I mean this sincerely, there's no magic number of times per week you need to have sex to be healthy. I get asked this all the time. The research suggests that regular activity, somewhere in the range of once or twice a week, is associated with certain health benefits. But regular is relative, and individual differences are huge. Don't let a number make you feel inadequate or anxious. Your body is not a machine with a maintenance schedule. It's a complex adaptive system that responds to how you treat it overall. Take care of yourself. Eat well. Move your body. Get your checkups. Stay connected to the people who matter to you. And if you've got questions you've been afraid to ask your doctor, write them down, bring them to your next appointment, and ask them out loud. That's what we're here for. I'm Dr. Ava Remington. I've been doing this for over 20 years, and I still believe the most powerful thing medicine can offer is honest, straightforward information delivered with respect. If you found this helpful, share it with someone who might need it. And I'll see you in the next one.